The only 5 exercises you need to improve back pain. Did you know that recent studies have shown that about 80% of the world's population will experience some type of lower back pain throughout their lifetime, making it one of the main causes of medical visits and work absence? Indeed, it's a quite frightening number. The good news is that many of these problems can be alleviated or even resolved with simple and specific exercises. You don't need expensive equipment, lift more weights than a crane, or endless hours of training. Just a few minutes daily dedicated to strengthening and mobility of the region can transform your quality of life, significantly reducing pain and restoring your mobility. Today, you will see the only 5 exercises you need to get rid of back pain once and for all. But before we begin, please tell us through the comments your name and the city where you are watching our content from. It's important to understand that if you are watching this video and suffer from back pain, you should see a doctor to identify the specific cause of your problem. Generally, they are associated with 4 main reasons. Number 1, postural problems. Our modern life, full of sedentary activities, such as sitting for long hours in front of the computer or on the phone, ends up creating significant muscle imbalances. Some muscles become excessively tense while others weaken, resulting in an inadequate posture that overloads the spine. Over time, this constant overload leads to chronic pain and persistent discomfort, especially in the lumbar and cervical regions. The most concerning thing is that many people don't even realize that they have compromised posture until pain manifests intensely. Number 2, degenerative changes in the discs and joints of the spine. With advancing age, the intervertebral discs, which function as shock absorbers between the vertebrae, naturally begin to lose water and elasticity, becoming thinner and less efficient in their impact absorption function. Simultaneously, the facet joints also suffer wear, resulting in conditions such as spinal osteoarthritis. These degenerative processes are a natural part of aging, but can be accelerated by factors such as excess weight, smoking, jobs that require repetitive physical effort, and even genetic predisposition. Number 3, spondylolisthesis. Spondyololisthesis is a condition characterized by the slippage of one vertebra over another, most commonly in the lumbar region. This problem can be congenital, develop during adolescence, or result from trauma and wear over time. As one vertebra slides over another, compression of the spinal nerves can occur, resulting in lower back pain, radiating pain to the legs, tingling, and even muscle weakness in more severe cases. Number 4, spinal stenosis. Spinal stenosis consists of the narrowing of the spinal canal, the space through which the spinal cord passes. This narrowing usually arises due to excessive bone growth, thickening of ligaments, or disc herniations, all frequently related to the aging process and arthritis. With the decrease in available space, compression of nerve structures occurs, causing symptoms such as pain, numbness, and weakness, especially when walking or standing for prolonged periods. A characteristic sign of spinal stenosis is the relief of symptoms when sitting or bending the trunk forward. Now that you already know the reasons why most people suffer from back pain, let's move on to the 5 exercises that will change everything. Exercise number 1, seated forward bend. This exercise provides a deep stretch of the posterior chain of the body, including the thoracolumbar fascia, paravertebral muscles, hamstrings, and glutes, structures that are frequently tense and shortened in people with lower back problems. When these posterior muscles are rigid, they exert constant traction on the pelvis and spine, altering their natural alignment and contributing to chronic pain. This exercise also stimulates the parasympathetic nervous system, responsible for reducing stress and body tension, which is particularly beneficial considering that stress often manifests as muscle tension in the back. For those who spend a lot of time sitting, this movement can counteract the negative effects of prolonged posture, helping to restore the natural range of motion of the spine and pelvis. To correctly execute the seated forward bend, start by sitting on the floor with your legs extended in front of you, feet slightly apart, approximately shoulder width. Keep your knees with a slight flex, especially if you feel a lot of tension in the hamstrings. Take a deep breath in and, as you exhale, begin to tilt your trunk forward from the hips, not the waist. Imagine that there is a hinge at your hips and that your trunk is moving like a closing door. Keep your spine as elongated as possible during the initial movement, avoiding rounding your back immediately. Extend your arms forward toward your feet, but without forcing to reach them. Go as far as comfortable, focusing on the sensation of stretching, not on touching your feet. Hold the position for a few seconds, and with each exhalation, try to relax more deeply into the stretch, allowing gravity to help gradually deepen the bend. Some common mistakes to avoid include forcing your body to go beyond your current flexibility limit, which can cause injuries or aggravate existing problems. Another frequent error is bending from the lumbar region instead of the hips, which puts excessive pressure on the lumbar discs. Also, avoid completely locking your knees, as this increases tension in the hamstrings and can reduce the benefits for the spine. I recommend maintaining the final position for 30 seconds to 1 minute initially, gradually increasing to 2 to 3 minutes as your flexibility improves. Perform this exercise 1 to 2 times a day, preferably when the muscles are warmed up, such as after a light walk or a hot bath. If you feel tingling or numbness in your legs during the exercise, immediately reduce the intensity of the stretch. Exercise 2. Cat-cow. This practice derived from yoga is truly transformative for those suffering from back pain, as it works directly on the mobility of the spine, stimulating each segment individually. By alternating between positions of flexion and extension of the spine, the cat-cow promotes the nutrition of the intervertebral discs through movement, something fundamental considering that these discs do not have their own blood supply and depend on this movement to receive essential nutrients. For those suffering from stiffness in the spine, this exercise is particularly beneficial because it mobilizes all regions, lumbar, thoracic, and cervical, in a gentle and progressive manner. These deep muscles frequently weaken in people with chronic lower back pain, and the cat-cow helps reactivate them safely. Another impressive benefit is the release of tension between the vertebrae, promoting a gentle traction that relieves nerve compression, often the immediate cause of pain. To correctly execute the cat-cow exercise, start by positioning yourself on all fours, with knees aligned with hips and wrists aligned with shoulders. Keep your fingers well spread and pressed against the floor to better distribute weight and protect your wrists. The spine should start in a neutral position, with a slight natural curve in the lumbar region. As you inhale, enter the cow position. Let your belly drop toward the floor, elevate your chest and tailbone toward the ceiling, creating a concavity in the spine. Your gaze should gently be directed upward, without forcing the neck. Then, as you exhale, move into the cat position. Arch your back upward like a scared cat, pressing your hands against the floor, contracting your abdomen, and bringing your chin toward your chest. Do not perform the movement abruptly or too quickly. Breathing should guide the rhythm of the exercise, keeping it fluid and controlled. Also avoid hyperflexing or hyperextending the neck. The movement of the head should naturally follow the undulation of the spine without forcing the limits of its amplitude. Another frequent error is keeping the elbows locked or shoulders tensed. Try to maintain a slight flexion in the elbows and the shoulders relaxed, away from the ears. Finally, don't neglect coordinated breathing with the movement, as it enhances the benefits and facilitates correct execution. I recommend performing 8 to 10 repetitions of this movement in a slow and controlled manner, 1 to 2 times a day. If you are just starting, you can begin with just 5 repetitions and gradually increase. The important thing is to maintain the quality of the movement, paying attention to the body's sensations and respecting its limits. This exercise is especially beneficial when performed first thing in the morning, helping to awaken the spine after the period of immobility during sleep, and also at the end of the day to relieve accumulated tension. Exercise 3. Spinal Twist. The third essential exercise is the spinal twist, a movement that works directly on the rotational mobility of the spine, an aspect frequently neglected in conventional exercise programs for the back. This controlled twist offers extraordinary benefits, starting with the mobilization of the facet joints, small joints between the vertebrae that, when rigid, can be a significant source of pain. Gentle twists help improve the lubrication of these joints, reducing friction and promoting more fluid movement. The spinal twist also works directly on the oblique and rotator muscles of the spine, which are essential for everyday movements such as turning to look behind or reaching for objects. When these muscles are weak or unbalanced, simple tasks can become painful and even cause injuries. Another notable benefit is the decompression of the intervertebral discs during the twist, which allows greater flow of synovial fluid to these structures. To execute correctly, start sitting on the floor with your legs extended in front of you. Bend your right knee and place your right foot on the outside of your left knee. Keep your left leg extended on the floor. Then, Place your left arm or elbow on the outside of your right knee, using it as leverage for rotation. Rotate your trunk to the right, positioning your right hand on the floor behind your hip for support. Keep your spine elongated, as if you were trying to grow toward the ceiling while performing the twist. The rotation should begin at the base of the spine and gradually progress to the neck, where you can gently look over your right shoulder. Some common mistakes to avoid include rounding your back during the twist. Keep your spine elongated throughout the movement. Also avoid forcing the rotation beyond your comfortable limit. The twist should be progressive and never cause acute pain. Another frequent error is letting the hip lift off the floor. Keep both hip bones firmly anchored to the ground to ensure that the movement really occurs in the spine. I recommend maintaining each twist for 20 to 30 seconds, breathing deeply, and then switching sides. Perform 2 to 3 series on each side, daily. This exercise is particularly beneficial when practiced regularly throughout the day, especially after long periods of sitting. Before continuing to the fourth exercise, don't forget to subscribe to the channel. Having constant access to correct and science-based information is what will make you progress in the long term in the world of bodybuilding. Exercise 4. Child's Pose. What makes this exercise particularly effective is its ability to promote a natural decompression of the intervertebral discs, especially in the lumbar region, where many people feel chronic pain. Another surprising benefit is the calming effect on the nervous system. The slightly curved and protected position activates the parasympathetic nervous system, responsible for reducing stress and body tension. For those who suffer from sciatica or disc herniation, this posture can offer significant relief by opening space between the vertebrae, reducing pressure on nerve roots that may be compressed. To correctly execute the child's pose, start by kneeling on the floor with your toes together and knees separated approximately hip width, or a little more if more comfortable. Sit on your heels and lean your trunk forward, extending your arms in front of you. Allow your chest to rest between your knees and your forehead to gently touch the floor. The arms can be extended forward with palms down, or relaxed at the side of the body with palms up, depending on what is more comfortable for you. Keep the shoulders away from the ears, allowing them to relax toward the floor. Some common mistakes to avoid include forcing the glutes down toward the heels when this causes discomfort in the knees. In this case, you can place a pillow between the glutes and heels to reduce pressure. Another error is keeping the neck tense. Remember to allow the head to naturally weigh down toward the floor. Some people also make the mistake of holding their breath. Maintain deep and constant breathing, feeling how the abdomen expands against the thighs with each inhalation. I recommend staying in the child's pose for 1 to 3 minutes, breathing deeply. You can practice this exercise 2 to 3 times a day, especially at times when you feel increased tension in your back. A valuable tip is to use it as a resting position between other exercises, or even during the workday when you need a break to relieve accumulated tension. Exercise 5. Superman. This exercise is particularly valuable because it works directly on the erector spinae muscles, mainly the posterior stabilizers that frequently weaken due to a sedentary lifestyle and prolonged inadequate posture. These muscles form a true natural support vest for your spine, and when they are strong, they significantly reduce the load on passive structures such as discs and ligaments. What makes the Superman so special is its ability to work the entire posterior chain of the body in an integrated manner, from the cervical muscles to the glutes and hamstrings. This coordinated activation is crucial, as it reflects how our body should naturally function during everyday movements. Additionally, the exercise promotes strengthening in a position of spine extension, counteracting the excess flexion we subject our spine to daily when sitting, driving, and using electronic devices. Studies show that specifically strengthening these extensor muscles can significantly reduce lower back pain in chronic patients, in addition to improving resistance to muscle fatigue. To execute the Superman correctly, lie face down on a mat or comfortable surface, with arms extended forward, in line with the shoulders, and legs extended. Keep the neck in a neutral position, looking at the floor and not forward, avoiding cervical hyperextension. Before starting the movement, slightly engage the core, feeling the navel approaching the spine, which will protect the lumbar region during the exercise. Then, inhaling, simultaneously elevate the arms, chest, and legs off the floor, keeping the limbs straight, but not locked. Imagine that you are trying to stretch in opposite directions, like a Superman flying. The elevation does not need to be excessive. About 4 to 6 inches from the floor is sufficient to adequately activate the musculature. A common mistake to avoid is excessively hyperextending the lumbar spine, which can compress the articular facets and cause discomfort. The movement should involve a moderate extension, not extreme. Another frequent error is elevating the arms and legs using momentum or abrupt movements. The Superman should be executed with control, emphasizing quality over quantity. Many people also neglect the position of the neck, looking forward and creating tension in the cervical area. Keep your gaze directed at the floor, with the neck as a natural continuation of the spine. I recommend starting with 2 to 3 sets of 8 to 10 repetitions, maintaining each elevated position for 2 to 3 seconds before controllably returning to the starting position. As you develop strength, you can increase to 12 to 15 repetitions or extend the time in the elevated position to 5 seconds. This exercise should be performed 2 to 3 times a week, allowing at least 1 day of recovery between sessions. Now, one last very important warning. If you want these exercises to have even more effects, you need to avoid other mistakes that have nothing to do with the execution itself. Therefore, if you want to know what are the 11 most common mistakes that most people make and that unfortunately throw all the effort in the trash, we have a video showing each of them appearing on the screen right now. Thank you for watching until here, and may God bless you, my friend.